What's up YouTube? If you're new here, my name is J.R. Smith. I'm a first year medical student at the Mayo Clinic. And although I'm just a first year, I have come across a few realizations over the past couple of months, and I wanted to create a quick video sharing 3 things that I wish I knew before starting medical school. If you're a pre-medical student, I hope this resonates with you. And if you're a current medical student or anyone else with pertinent experience, please add to the discussion by commenting down things that you wish you knew before starting medical school so that we can all benefit from each other's shared knowledge and experiences. So let's just start with the elephant in the room. The amount of material that you are required to learn and retain is legitimately leaps and bounds above what you're called to learn in undergrad. Let me give you an example. In undergrad, it takes a full semester to cover biochemistry. That's about 18 weeks. We did it in 4. Now, of course, in the case of biochemistry, some of the material is just a review, but I can tell you that the pace of learning does not slow down for material that wasn't covered in undergrad. And you'll even learn new things related to the old things that you learned before, and all of those small, fine details that you were able to skim through and skip past in undergrad are actually relevant now. That is because we aren't just learning to pass a test, though that is definitely part of it, but we're learning to treat real people or real life future patients, and the fine details matter for this. I'll give you another example. I'm in anatomy right now, final coming up this week, but I've taken an anatomy-like course in undergrad, far from a medical school anatomy class, but we learned some of the basic generic anatomical structures in the human body. But the difference is in undergrad, if we're learning about the hip, we may learn about 2 muscles and that they're called the gluteus medius and gluteus minimus, and we may even learn that they're innervated by the superior gluteal nerve, and that's about it, not too hard. But in medical school, we're studying to be doctors, so we always have to sprinkle in some clinical correlates or clinical pearls related to whatever we're studying. So now we'll learn the anatomy like how we may have in an undergraduate anatomy course, but now we'll learn that damage to the superior gluteal nerve or a 5th lumbar lesion can cause paralysis of the gluteus medius and gluteus minimus. And this can be recognized through the Trendelenburg gait, which is a result of unilateral paralysis of our hip abductors. As you can see, I'm studying right now too. Multitasking, guys, multitasking. Again, now we're studying to be good physicians for our patients, and they will rely on us to have a thorough understanding of the material. Now, this probably seems extremely intimidating, but this brings me to my second point. In medical school, you will inevitably learn how you learn. Resource overload is real, whether it be Anki or textbooks or Boards and Beyond or Sketchy. You will have so many resources thrown at you that you will inevitably be overwhelmed by it. But this can actually be beneficial for you because it forces you to figure out what works for you. Part of medical school is setting the foundation for us learning how we learn. In medicine, this is ultimately a profession where we are involved in lifelong learning, and being able to know what strategies best facilitate our personal learning is going to be not only effective in medical school, but in our careers beyond. I will be going over my study routine and the resources I use in an upcoming video, so stay tuned for that. But with so much material that we're called to learn and retain, we're forced to kind of figure out what's most effective and efficient for us. And of course, this will vary from person to person, but I don't know any other experience that forces you to develop fine-tuned strategies for learning than going to medical school. And once you figure out what works for you, trust it and stick with it. And this brings me to my last point. It will be so easy to find yourself comparing yourself to others. Like a lot of people talk about imposter syndrome and just how easy it is to compare yourself to others in medical school. Guys, it is real. Everybody in medical school is extremely bright and extremely hardworking, and this may be the first time that a lot of people aren't going to be the smartest person in their class. I never really had that issue because I never was the smartest person in my class. But I worked hard, so I guess that worked out. But now everybody is super smart and super diligent, and it can cause you to feel like you don't belong, or it can cause you to feel like you're missing out on opportunities to do things that your classmates are doing, or that you're just constantly falling behind everybody else. If you begin medical school aware of this imposter syndrome, you may be more prepared to stay in your lane, understanding that your classmates are going to be brilliant and are going to have certain strategies that work for them, but you're going to be able to trust in your own intelligence, work ethic, and study strategies, and that is key. You can't really learn effectively if you're being anxious or worrying about if you're learning enough or learning as much as your classmates. Medical school is an opportunity that we get to celebrate the genius of our classmates. And everyone is going to have their own particular interests that they are drawn to and just naturally excel in. So if you can focus on your own learning without falling victim to comparison, you'll learn better, you'll enjoy it a whole lot more, and you'll be better suited to actually celebrate the genius of your classmates. So those are the 3 things that I wish I knew before starting medical school. I hope some of these points resonate with you, and I hope they can help prepare some of you pre-meds out there. If you enjoyed this video, be sure to give me a thumbs up. It really helps support this channel. If you haven't yet, be sure to subscribe, tap that bell. New videos every week. You're not gonna wanna miss one. And of course, until the next one, keep evolving, and I'll see you guys soon. If you're